Hey guys, welcome to the E-Circuit. This is Real Talk with Christine Kiai, but as you can see, of course, I'm not Christine Kiai. I'm filling in for her for today because we're about to have like the real talk. There were some frequently asked questions about family planning, and I specifically asked Christine just to let me dive into this. Now I'm joined by Florence. She's a nurse by profession. I would like you to introduce yourself to the people.
Thank you for letting me come in this morning. I'm Florence Kioko. I'm a nurse by profession, having a rich background and experience on reproductive health, and I'll help the community and the population of Kenya in general.
Nice. But you're not just a nurse. You do other things like interior design, shoes as well. You dive into different things, yeah?
Yes, as you know, in Kenya, you cannot depend on one occupation. And also there are other passions which we could not. As a person, you cannot cover all in one course in Kenya. So my big side hustle is business. I sell ladies' shoes, handbags, duvets, and I'm also having an interest on designing curtains. That's nice.
Yep. That's awesome. Now I want us to dive straight into this topic because I think it's something. Once you reach a certain age, you know, like it's not even a peak. Once you're at a certain age in your teenagehood, you start to develop these emotions that you can't really explain. So I think family planning is essential, and having this information is essential so that people are prepared.
Thank you, Mike. Let me start by introducing what is family planning. Yeah. Family planning, it is a service, a medical and a social service, which every person has a right to reach, and not just a right to it. It should be in a respectful manner. It should be a respectful manner.
Okay.
And also, it should be given in confidentiality way.
Okay.
Yeah. So the family planning itself, it is a service which helps someone, whether in a marriage or planning to get married, to have the knowledge about the spacing, timing, and the number of children they would love to have.
But that's like a perfect situation. But we all know, like, there are other people who are not really planning on getting married, but they are planning on having sex. So this information is also good because so that if they're not ready to get kids, they shouldn't get kids.
Yeah, true. Whether you are in marriage or you are planning one day you will get married, you have a right to information about family planning and also to the methods.
Let me start with this question. What's the most frequently asked questions? Let me start with the ladies, because I think with men, the only other two options, it's like a vasectomy or using condoms, you know. But for women, there are other options, and I think they have the most questions because most of the time they hear like this can interfere with your hormonal balance, this can interfere with this and that. So what's the most frequently asked questions by the ladies?
Okay, most of the clients, when they get to us about family plan, the first question they'll ask you, which is the best family planning method?
Which is the best or the most effective?
Yes.
And what is the answer? Which is the best one?
The answer is, today I'll let you know how the family planning method. We'll also do some, we call them vital signs, that is the weight, the blood pressure, and we take a small history, medical history. Then from there, you are able to advise a client which is the best and effective family planning for them.
Because it varies, every woman is different.
True.
Okay.
You can, a certain family planning can be the best for me and not for another female client.
Okay.
Yep.
So how do you go about this? Is it about the test, or is it a line of questioning so that you're able to deduce, okay, this is good for you and this is not good for you?
Yes, as I've said, we'll do what we call vital signs. That is we measure basic needs about your weight, blood pressure, and also sometimes the pulse rate, the respiratory rate. Then we get into the medical history. Somebody who has history of hypertension, somebody who has history of deep thrombosis, that is the DVT, the notes they get on their legs and the swellings, they may not have the right to some family planning method.
Okay.
Yeah. and also other medical conditions like chronic disease. Even in HIV, some methods, due to use of other drugs, the effectiveness of the family planning method can be lowered by the ARVs. So we need to get the real medical history. But every lady has a right to a family planning method. Yes.
Are there family planning methods that you would not recommend? Like something you've seen cases where the side effects are more severe and it's not really worth it?
For sure, all the family planning have minor side effects.
Okay.
If you get to the right medical history. You cannot say there's a family planning which the disadvantages outweigh the advantages. That is not true. Most of the family planning, despite they have some minor side effects, the advantages outweigh the disadvantages. Yep.
When you were listing the options available and what is used to determine the options available,
yes,
I didn't hear you mention age. Could that be a factor as well, like for the female clients, when it comes to like the options available?
There is no contraindication like about age and family planning.
Okay, like someone closer to menopause or something?
No.
No.
No. It cuts across.
It cuts across.
Yes.
It just depends with these other factors like your blood pressure and your weight.
Yes, yes.
Okay.
And at that point, I can also add that family planning, it's for any sexual active client, despite their age group. Yeah, in Kenya we are running now from 13 years. Yes.
Interesting. Behind you rather, there's a few options, and I want to ask you about one in particular, the implant. Let me ask you about the ones that are more popular among the young kids,
yes,
the youth who are our viewers, like the IUD and the implant. Let's
yes,
start with the implant. The implant is something that you put in your arm.
Yes.
It's a small procedure.
It is.
But it releases hormones on occasion to yes, block or something. Could you explain that to us?
Okay. What you have said, the implants and the IUCD,
okay,
they are in one category. That category, we call it long-acting contraceptives. We are calling them acting because they're from 3 years to even up to 10 years. They
can stay in your body for 10 years?
The IUCD. Yes.
Okay.
So, how the no plant works, no plant we have, implants we have two.
Okay.
We have the Implanon and we have the Jatel. One is for 3 years, the other one is for 5 years.
Okay.
So you see, when you get one, you'll stay for 3 years. But that doesn't necessarily mean that if you want a baby within that 3 years, it cannot be removed.
But how long would it take for you to get pregnant after removing it?
After removal, I know there are stories about the delayed fertility, back to fertility when you... But for sure, it's not true. When you are on that family planning method and maybe you decide now, I've stayed with this family planning for 1 year, I now want to get a baby. When you remove that family planning method, and of course work with your reproductive health officer, because sometimes we tend to look for a baby, but we are not doing during the safe sex days. Then you start saying, sipati mtoto tena, I'm not bearing a child. I think it's because of that family planning. And there, it's when the myth and misconception about family planning, especially in Kenya, there are thousands.
Because of all those other factors like the safe days, which is actually something we're going to talk about, but eventually.
Yes.
Now with this implant, these hormonal changes that occur, the side effects are something that people are not... They don't find them appealing. Sometimes even the moods change. So is there something to counter it when it happens? Because even the menstrual cycle even changes sometimes because it's something hormonal. So it's like, do you take the implant along with like other things, like other pills, to counter all those other side effects that happen?
I hear you. Now, about the side effects of family planning methods, it will be a shock, a worrying symptoms for a client who did not get enough health education before. Because when you sit with a client before choosing any family planning, they will get to understand the minor side effects which may occur with this family planning and what to do when they occur.
Okay.
Most of our ladies in Kenya, in the reproductive health system, most of them, they come to the clinic with a set mind of the family planning they want to use. Why? Because they have just inquired from their friends. Yeah, you know, when we are in a plot, we are washing clothes, we start discussing this. When we go to a chama, we want to discuss a family planning. Then I tell you, Mike, look here, me, I'm using IUCD, it's doing good for me. So when I'm going to the clinic, I just want that IUCD.
And that's the one you want.
Yes, even if a health provider wants to sit with me and explain, this does this to this, this does this, this can be used by this kind of reproductive health women, I insist still I want the IUCD. And because when I start now getting heavy menses, I say, my friend doesn't get those side effects. So I'm like, this family planning is bad, why me? So with clear preparation of a client on minor side effects, I call them minor side effects, because every drug has a minor side effect and a major side effect. So it's a matter of giving the client adequate information and also the client opening up to listen and ask questions before any family planning method.
Thank you so much, Florence. Bado tunaendelea na maswali 22162 starting with the word circuit. Let us know if you have any questions about family planning. I have a lot of questions. I don't think now. So if you have any questions, again, 22162 starting with the word circuit, or on our Facebook channel, that is Y254 channel. Also on Twitter and Instagram. Florence, there's something I want to ask you about two methods behind you. There's the diaphragm and the UID.
Yes.
They're more or less the same thing because they do the same thing. But can you explain the difference between those two? Because they're also very, very popular.
Okay, Mike, at this point, please allow me, we discuss the types of family planning.
You want to discuss all of them first of all? Because
we group them. Let's group them. Yeah, let's group
please
them.
Do. Okay.
We have the natural family planning method.
Okay.
The natural family planning method, sometimes we call them the calendar method.
Which don't really work. That's actually why I wanted to get to those ones last.
Yes, I'm just grouping them.
Okay.
Then there is the hormonal contraceptives.
Okay.
Which some are, they are divided into two, the short term, that is the pills, and the injectable depot. Then we have the long acting.
The long acting, like the
implant and IUCD. Okay. Then we have the surgical. Yeah. Okay. Sterilization, vasectomy, and tubal ligation. Yeah. So now we can get back now to IUCD. Before we finish, there's the other one of which where the diaphragm which is coming from. Okay. They are called barrier.
Barrier.
Yes. They include the condom. There's a cream called spermicide.
Spermicide.
Yes. And now the diaphragm you're asking about. Some countries have the cervical caps.
Which is like more or less like the diaphragm.
The diaphragm, yeah.
Okay.
Yes.
Okay.
Yes.
Now let's talk about those two, the UID and the diaphragm.
Yeah, the diaphragm.
Let's start with the UID. There's something actually really interesting when it comes to family planning, because it's not even just about the methods, it's about the couples themselves. Have you ever seen a situation where the man is not really that willing to let the woman go through this, because sometimes it's either an ego thing, they want, especially like there are other factors, like they specify, okay, I want my wife or my girlfriend to have like a female gynecologist. That doesn't happen. This is not happening. How do we combat such things? Because this is not as an implant, because an implant ni komkono or something, or like pills. This is something more intrusive.
Thank you, Mike. And I can really try to say, for sure, I'm feeling good that these topics are being introduced about family planning, and we're incorporating the youth. I'll start by saying 75% of the Kenyans, they don't discuss about family planning in marriage.
Even within themselves?
Yes, 75%.
Okay.
And more about the clients in the low-income population.
Okay.
Most of the clients, your partner will not tell you to go for a family planning method.
Okay.
But they will not need a baby immediately after the baby you got. They'll need spacing.
Okay.
But that law is left to the female to plan about that part.
Okay.
When you ask the men, they'll tell you, hiyo ni kazi yake ajipange.
Oh, jipange.
Yeah, jipange tu. Yeah, but don't tell me you have another pregnancy. No, mtoto hajafikisha 3 years or so. Okay?
And at the same time, you're not supposed to deny
where is
sex,
that coming
which is
from?
really, really tricky.
Yes.
Okay.
Mike, where is that coming from? This is coming from how we were brought up. The topic about sex.
It's like it was taboo to talk about it.
Yes.
Okay.
And we have grown to it. And as I told you, family planning is a medical and social activity. You want to discuss with your partner. But if you ask people, did you sit with your partner and said, maybe this is the right time we need a baby? No.
Just
all of us who are firstborn, I think we came like by mistake. Yeah. Okay. It was not planned. Or it was the point that now my mom had to get married. Yeah. There was no room for discussion.
Or planning.
Yes, and planning.
Yeah.
Same today. Even if I have 2 babies, we have not discussed with my husband. Who is the problem here? Both of us. We have not taken time to see, and maybe the husband to help you choose or walk with you to the clinic. Maybe you get this information, then you choose together. So
that is also like a really huge factor. This
it's a huge gap.
It's like it could be an ego thing, but it's also that taboo mentality that you can't freely talk about sex. How do we remove that taboo? Is it by having programs like this that openly talk about contraceptives, about sex, or is it something more internal, as in, do couples just need to open up more? What do you think?
It's true. This is part of what she's supposed to be doing. We also have, as our parents, I'll not let it first go to the schools. Yeah, schools, they have their part to play. But me as a parent, yeah, have I started talking to my child about sex? And it starts by the child when they see something on the TV, they ask you, what do you ask? There was this advert about condom. I saw most of the parents were discussing it on the Facebook. Yeah. And
discouraging it, actually.
They were like, hii kitu inafaa kuletwa saa ile watoto wamelala. Yeah.
Which is really interesting.
So the stigma is starting with us as parents. But when we start talking about it early, if a child can ask you about sex, they will be able to ask about their partners about sex.
That's actually interesting, because even the parents sometimes don't have the information. Because as we said, they don't openly talk about sex. It's still taboo, even in their own relationships. So as a counselor, have you ever faced such a situation where someone is so stubborn that they feel like they know more? Like I know it's the men who are mostly guilty about this. They want to do like mostly the natural method, which we are going to talk about now. They want to space out, let's look at the safe days. Even there's an app for it on Android and iTunes.
It's true.
So how do you explain to them it's for your own good that you're able to talk about this?
True. Most of the men, if you want to know they are in a difficult situation, is when they come for their consultations. They will start asking you, is it normal for somebody to be on period for 1 month? Or my wife has done an abortion. But they have not discussed it with their wife.
They're coming to talk about it with you. They just coming to talk
about, and it's after consultation when we are almost giving out a prescription. When you ask them, do you have a question? Then they say, kuna hii kitu. Then it starts the discussion again.
Get to why they were there.
If you're open enough, they'll tell you. And they say, no. When you're telling them now, you need to be, because nowadays, HIV test, it's like when you're doing every consultation. When you tell them now how to prevent HIV, then they say, no, my wife is on period throughout the month. So what do I do as a man? Then you ask, did you discuss about this? How did it start? I don't know. Nizo vitu zenu munatumia.
Now the side effects, the minimal side effects we were talking about.
See? And who has the side effects didn't know, she's supposed to go back to the clinic and get
something better. Oh, she
So
was
you
thinking
say-
that's her only option.
Yeah.
Because as you said, her friend told her
Yes.
this is the best one.
Yes. So you see, it is a circle, and the gap is growing wider day by day. Yeah.
Because these misinformed parents are not informing the children as
Misinformation,
well.
No health talks. Clients just want to copy what my neighbor is doing, and it gets complicated. Now back to our IUCD. It is one of the perfect family planning methods. But most of the clients have the misconception. Number one, about the procedure. Yeah. Now they will ask you, Daktari, the positioning, what will be used. I think you understand when I say when they have to get to bed, there is something which will be inserted on the private part. Then the doctor will do the procedure. Now they prefer to just come, an injection is done, and you go.
Yeah.
But IUCD is one of the perfect family
But
planning
people,
method.
especially I think in our country, they don't want to use it because it involves, and it's very invasive.
The procedure,
Yeah.
if you have not prepared the client properly, maybe they'll fear what they were taught by their friends. Kuna chuma itaekwa. You see?
Okay.
But nowadays, it's not even chuma. Things are getting better and something. Yeah,
exactly.
Yeah.
I think also like another fear that they might have is it might interfere with the other part of
the uterus.
No, not exactly. I think they think that it might interfere with sex itself.
Yeah.
Like it might interfere with pleasure or something.
Yeah, they say that, which is not true, because it is on the upper part.
Okay.
It is on the side of the uterus. Number 3, they say it can travel to the brain, to the heart, which is not true. Yeah. They say even it can go to the baby's mind or the chest, which is not true. So I'm saying the myth and misconception and the broad contribution to this is lack of the right information.
Lack of the right information.
Yes.
The reason I wanted to talk about those two especially is because they're more intrusive. So those fears that you just highlighted, actually the reason why I asked. So how do you talk to these people and make them understand these things don't happen? Yeah.
We are doing most of the government facilities. They have the health talks. They use the community health volunteers, and as the clients are waiting to be seen at the waiting bay, these topics are on and this discussion are ongoing. I've seen programs like Reproductive Health Network Kenya.
Okay.
They are doing a great work, community awareness and mobilization, especially to the reproductive health. And the good thing that going to reach the people who are in the slums, the guys who maybe will not get to watch a TV, will not get time to get bundles and internets to Google. And it is helping clients. And what we are doing today, I'm sure somebody will get informed today and will want to know more. Yeah. And we
actually,
are there.
I think we're helping a lot of people. Guys, this is something actually we need to highlight. I think we need to start having open conversations about sex, about contraceptives, about family planning, because especially if you're young and you're not ready to have kids, this is your perfect conversation, and this is the program you're supposed to be watching. If you have any questions, 22162 starting with the word circuit, or on our Facebook channel, which is Y254.
Yes.
I think we can never exhaust this, because there's also another question about the female condom. Is it even sold in Kenya?
The female family planning method, the condom.
The female condom.
It is even in the government hospital. Yes.
Why are people not using it as much?
Back to the creating of awareness. I'm sure most of the people have not seen it. Next time I'll come with all the family planning methods.
Please do.
I will come with them. Okay. We need to demonstrate some of this. We need to show them maybe the packaging, so that when they're asking for the methods, they can tell a daktari is this one, even if they don't know the names, because most of the medical names, they are big. So they can tell, is this one, daktari is this one. Because when you come to a clinic, we display all the family planning methods, we explain each, then you get to understand.
Does.
Yes.
But then again, there's also the other part, which you said is like testing, checking for hypertension, checking the body weight.
Yes.
Is that part expensive or is it free? Because I think that's something also the people would like to know.
Number one, in the government facilities.
In the government facilities, okay.
Doing weight, doing BP, it's free of charge.
It's free of charge.
Doing family planning method in a government hospital, I'll talk in Nairobi.
Okay.
Because I know most of them. We have collaborated with most of the health facilities in Nairobi.
Okay.
It's free. It's free. And I thank God most of the NGOs, even the CBOs, they are the ones who are updating us with this knowledge.
Okay.
Afia Jijini has just done a training for us less than 3 weeks ago. And it was great. People are getting more knowledge. The workers, they want to be educated on now. Number one, trust and respect to the clients.
Okay.
You know, when you start there, you will win this client. But when you come for a family planning method, and the health worker is not committed to listen, just to listen to this client. And maybe let her know, yeah, you have told me today you want depot, but do you know also we have IUCD? Do you know also we have the female condom? That will grow the mind of the client and she'll go home with the best.
And understand that she has choices.
Yes.
Okay, this is interesting. Now, what I would like us to finish with is the sterilization part.
Yes.
We're going to talk about both for women and for the men, because I think that comes across as the last option. You know, it comes across as the last option, and we need to understand why. Because most of the time people think it cannot be reversed. I think even for the men, that's their greatest fear. They might want to have more kids eventually. Now, when you tell them the verse is going to be cut and snipped and all these things happening, or someone hearing that's going to happen to their wife, they get scared.
True.
But is it reversible, first and foremost? Let's start with the men.
It can be done.
It can be reversed?
Yeah, it can.
Okay.
It can. And I don't want to categorize it as the last. You're also having a stigma.
I'm not having a stigma.
Because
I'm just well researched.
No, that is the situation, but it is an individual choice. Why am I saying this? I'm saying this because if men were walking their women to the labor ward, you could be the first one to tell her at 6 weeks. Sweetheart, we did go for a family planning method. For the men who have walked their women to delivery room, they are the ones to remember the dates for next appointment, family planning for their partners. It's not easy. And you will want, if you love this lady, you will want her to recover fully before the next pregnancy. You will also need your child to have the best, because you have the knowledge about breastfeeding, care, and also you yourself, as a man, you can be forgotten in a family when this lady is having so much a lot. Let's understand, from delivery to 6 months, these ladies, they suffer psychologically more. So they need a lot of support. So that natural, surgical sterilization, the vasectomy, with that knowledge and being following what is happening in health of your partner, it not be a hard decision for you to make. How does it come in? For example, there are ladies who, after every delivery, they go into a coma, or they get what we call postpartum hemorrhage, bleeding post-delivery. If you see your...
Which could actually be fatal in some cases.
Yes.
Okay.
And you see your lady has suffered all those problems, and you love her, and maybe you got to the number of kids you have. People say 3 or 2. That is not the way we say in family planning. I said it is the timely, the spacing, and you get the right number of children. They can be 10, but you have done family planning nicely. They can be 7, they can be 1, according to the number you chose. So a man to decide now, I need to get to family planning method. Of course, now there are 3. You know, the pills have come up, still new in Kenya, pills for men.
Do they actually work? That's why I didn't want to address them. I think everyone is curious about them, but I needed it to be gazetted before I asked about it. Have they been released? Do they work? Let me just cut you short for a minute.
We are waiting for it to be brought up to the public. But as Kenyans, you know, we are eager to start things. Guys have started.
Did you bring some?
Next time.
Interesting.
Yes. So, the last one, which you said vasectomy, men do it. And it's funny enough, men are doing it without telling their partner. And it is bringing issues.
Of course it is. You know. Because now people are wondering why they're not getting pregnant. Yes. They end up blaming the other partner because they were secretive.
They're secretive. You can get married to a man. I can remember one time I had a woman who had 2 kids. Then she was trying hard to get the 3rd one. But little did she know the husband had gone through vasectomy. Why? When they came to the clinic and I was counseling one by one, the man told me, I have other 5 children and I'm supporting, but my wife doesn't know. Well, we go back to discussing about family planning as a marriage or as a both partners. One partner is worried about why I'm not getting another child. The other partner is nishaeka break. So you see, so vasectomy, you cannot say it's not a good family planning. It's not being practiced. It's being practiced. The problem is people are fearing to come out
and say that they are getting one.
Okay. Yes. Men are not knowing when we say a vasectomy, the procedure. They think they cannot participate in sexual activity anymore. They think they cannot be men enough. And I think when you want to kill a man, talk about their reproductive organs.
And tell them they don't work.
Yes. So I think the procedure needs to come out very clearly. This is only
what it involves.
It involves and what it will let you do and let you not do. The
part I'm curious about when it comes to vasectomy is how reversible is it? Can you give me like a figure in percentage?
I have not seen a lot of clients ask to be reversed because I think most of them, they have made a decision
to just finally get it snipped and over and done with. Yes. Is there an occurrence, actually, then let me ask this, is there an occasion when someone got snipped, someone had a vasectomy rather, and it didn't quite go so well, and they eventually get a kid? They're still fertile, they can still, reproduce.
The failure rate is 0.01.
It's that low?
It's low. It's low.
Okay.
Yeah. For the studies I've seen, it's very low. Yes.
Okay.
So it's a good family planning method, but with the right information.
With the right information, and I think also at the right time.
Yeah, the right time, and maybe with the right medical procedures. Yes. Just, I'm sure that one cannot be just done in the where we stay and watch. That need to be done by a trained, experienced medical personnel. Yes.
Yeah, I think anyone who would try that would ask for all your papers first of all.
Not really. There are good men out there. When they see what their women are going through,
they just take say, one for the team.
Let me do the vasectomy. Yes.
Interesting. Now let's go to the women.
Yes.
They also have surgical options.
Yes.
And I think with them, it's also the same fear, as in, if I want to reverse it, if I want to get kids eventually, will I still be able to get kids? Actually, there's also all these other options once someone is informed as well, because you also understand about hormones and everything, how it works, how your body works. They also ask questions like, will my sex drive be the same? So how do you go about that and giving them that information? First of all, how would you rate it when it comes to women? Is it the best one when it comes to women, the surgical options?
The tubal ligation, that is a surgical procedure. Most of the ladies, when they're in the labor ward, going through that pain, they always sing that song, daktari funga kabisa.
Oh my.
Daktari funga kabisa. But after they deliver and they go to the postnatal ward, you ask them, because at that point you cannot do, it's under influence of the pain. You ask them and you show them their babies. You ask them, you still having the idea now you need to, hapana si kusema hivyo.
Now they're getting more clarity.
Yeah, I didn't say that. Where did that come from? So tubal ligation is also, as you said, is a surgical procedure.
Okay.
To be explained to the female, both the male and female who are in a relationship. And ladies are doing it, especially. I think in Kenya we go for this surgical operation when there is a major medical concern. Yeah.
So it's not like at the top of the list.
And sometimes now the gynecologist needs to tell you, now this, it's either you take care, you lose your life with the next pregnancy, we have to do it. And of course they cannot force you. We say this is informed choice.
Okay.
So they'll take you through the dangers you are going through. Okay. And you'll discuss with them. You'll tell them if you want, your partner will sign, and there you go. And tubal ligation is good if you have decided I have enough family. Most of the people say, what if we get to accident and all my children die? And I've done tubal ligation. In Kenya, I've not seen a lot of people ask it to be reversed, but in other countries they do, and I think a good percentage is successful. But what I insist, Mike, is let's get the right information.
We get the right information.
And we make a decision when we are sober. And family planning and sexual life will be the perfect thing. Yes.
Sisa, I would like to do this. I would like you to speak as a counselor, not to the couples, not to the married people, but to the young people back at home, probably who have not yet had sex, but they're planning on having sex. So we've given them all the right information, but what other, like a parting shot that you can give them as someone who's about to start exploring sex?
Thank you. I want to talk to, let me start from the mature minors. In Kenya and in Nairobi, we are having a lot of mature minors. And especially in the low-income generation, where they see what their families are going through and they hoped sex as a source of income. Without good support and without, not as I said, our culture, not talking about sex, they will practice what their peers are doing. They will go with what they are hearing other women say. Because now they stop working with the children and start working with the married people in the plot and where they stay, in the estates. And what brings problem is there is nobody to guide them about the sexual. So they'll get a boyfriend who will give them 100 bob. They buy hunger for the family, they take home. The mother doesn't ask them where the hunger came from. Tomorrow they'll be given for the cabbage, for the tomatoes, and life now starts becoming a sexual life for them. I think they need to ask the right person. Even if your mother doesn't speak to you about sex, there's this good aunt of yours.
Someone who you're free with.
There's this daktari who passes by your place. Or you can walk to the health facility. When I get to a hospital, I can just check at one side, then I say, I can talk with this daktari. Sit down with them. They're also the community health volunteers. Look for one you think can help you. Talk about it. And if you are in you are sexual active and you really feel I need a family planning method. I need information about family planning method. That is the point now when you walk to daktari, they will discuss with you and let you know your parents can also made to understand this in a polite way. But remember, if you want to continue with that client, you need to be to keep the confidentiality information about them until you see if this parent is a parent you can work with. It's a parent who also needs to be cancelled first, taught, and brought to where at the level you are with the child. Yeah. So it's not easy for our youth what they are going through. I remember the other day as girls we were discussing about at what point did you discuss to your mother you have started menstrual period. And some said they were bought that time. For my age it was cotton wool. Every time you're going back to school your mother buys, but you are not getting periods. But when you ask others, they'll tell you one day it will come. You wonder when will this animal come? How will it come? Will it kill me? Will I be sick? You see? So it has to support those children who have started to have sexual feelings to choose the right path to walk.
Okay.
And for sure, if they have started and they're at risk of getting STIs, of getting pregnancy, we should not discriminate them from coming to the family planning. I said family planning is not the method alone. It is health education and making them to choose the right method for them.
With the right information.
Yes, with the right information. Yes.
Thank you so much, Florence Kioko, for coming through. I think this is one of those topics you can never exhaust, because not only my questions, everyone else's questions back at home, we're just curious about family planning in general.
It's true.
So thank you so much for coming through.
Thank you.
We appreciate it. And next time we want the demonstrations as well.
I'll come with all the methods here.
Please do.
Yeah.
Thanks, guys, for joining us. Again, if you still have any questions, Florence Kioko is ready to answer them. Just ask them on our Facebook page. That is Y254 channel on Facebook, Twitter, and Instagram. I'm a 22162 starting with the word circuit. Again, I'm Mike Itaya. I was filling it for Christian Kiai today on Real Talk. Until next time, cheers.
Thank you.